Hi, Dr. Baumholtz, Baumholtz Plastic Surgery, and let's spend a few minutes talking about abdominoplasty or tummy tuck. So you've had this child, or another scenario is you've had significant weight loss following the weight gain of typically pregnancy, and you have the three horsemen of an abdominoplasty. Specifically, you've got excess skin, you've got some maybe excess fat, and you've got some weakness to the lower abdominal muscles, also known as the mommy pooch. You've done your planks, you've done your hot yoga, you've done everything imaginable, and you can't seem to shake this excess skin. And even though you look at Instagram and see pictures of Hollywood actresses that seem to magically have a child and like nothing happened, I suspect Photoshop played some role in that, but nevertheless, in you at least, it's not going the way you want. Biologically, it's often related to the amount of collagen, the collagen content in the skin and its ability to snap back after that experience, and it goes down both with age and with significant weight changes. So don't beat yourself up too much about it. It's part of the process. Now, what are we going to do about it? If your problem is of all three tissue types, that is skin, fat, and muscle, we need to develop an operation that's going to address all three tissue types. And for me, that's a tummy tuck. Now, a traditional tummy tuck, and I'm going to explain the differences between a traditional tummy tuck, and in the next video, we'll talk about a different form of a tummy tuck known as a fleur-de-lis. And in another video, we'll talk about an even bigger form of a tummy tuck known as a body lift. For now, we're going to talk about a traditional tummy tuck. It's a low transverse, meaning going across, a low cut, low, low, low. I like to place my incisions very low. I don't know what fashion is going to be in 10 years. I just know my incisions are going to be below them, okay? So a low transverse incision, that gives us access to the body wall. We're going to plicate the muscles, meaning we're going to sew them back together so it's nice and flat, and I'm going to give you the best contour I can give you. I can't make you look like somebody else. And I'm limited by your anatomy as to what I can do, meaning your hips and your pelvis and your ribs and the physical constructs that aren't movable, right? We tighten the muscles, and then we're going to pull the skin down, and we're going to remove the vertical excess. And I'll define these terms in the different videos, but the vertical excess, what we're going to say is what's hanging over your belt buckle. And it can be a little or it can be a lot. If it's a little, we may choose just to move the belly button down a little bit. That's called an umbilical float. Or, more traditionally, we may leave the belly button exactly where it is, release it from the skin, pull the skin over top of it, and make a new opening for the belly button to come through. That's a tummy tuck in broad brushstrokes. And typically, at the time of the tummy tuck, I will also talk to you about likely doing some liposuction of your back, especially your low back, because that's going to help me contour your waistline as we pull things around. All right, stay tuned, because there are some folks that have both vertical excess and horizontal excess. And what do I mean by that? That's the skin that hangs over the sides, and we've got to do something with that. And maybe it's more than what a traditional tummy tuck can handle. In terms of having a tummy tuck, I need you to be in your best physical shape. I need you to be at a stable goal weight. Based on your age and medical history, we may ask your medical doctor to give what's called risk stratification, also known as medical clearance. Surgery itself, it's typically an outpatient procedure. You come in and go home the same day. And usually 2 to 3 weeks to heal the initial incisions and get rid of the drains. Yes, I do use drains. Another 3 weeks for you to feel like your old self. You're walking from like day one. We make you get up and walk. And then it's not for 3 months that I want you lifting anything more than 10 to 15 pounds. Well, that's abdominoplasty or tummy tuck in some broad brush strokes. If you'd like to know more, come for a consultation. You and I can talk more details. This is Dr. Baumholtz. Thanks so much.